Hi everyone, welcome to Ask the Horse Live. I'm your host, Michelle Anderson, Digital Managing Editor of The Horse. Tonight, our topic is internal parasite control programs, and it's brought to you by Bimeda. It's that time of year throughout much of the U.S. The grass is starting to get green, pastures are growing, and horses are back on turnout. It's also that time of year many of us remember we should probably have a fecal egg count done on our horses to see if they have an internal parasite burden. That's right, they need a test. Gone are the days of the rotational deworming program that we did every 8 weeks. Now veterinarians recommend regular testing and tailored parasite management programs. It can be confusing, right? Especially for those of us who've had horses for a long time. To help us out tonight and answer our questions, we're joined by Dr. Ray Kaplan, who is a parasitologist who helped author the American Association of Equine Practitioners Parasite Control Guidelines. Welcome, Dr. Kaplan.
Thank you.
Dr. Kaplan, can you tell us a little bit about your experience helping horse owners manage internal parasites and why this topic is so important for horse owners?
When I started at University of Georgia about 20 years ago, in veterinary parasitology, I started focusing early on looking at equine parasite control, and particularly drug resistance, which was becoming a problem back then, but really wasn't very well recognized. So I did a number of studies to identify the problem and measure the problem, and then along with that, try to develop strategies where we can control parasites better than we were before, but also help control the worsening of the drug resistance problem. So I've been working with equine parasites really all along for the last 20 years, and before that, when I was in practice, I did it a little bit differently in that I wasn't a parasitologist and I was just a clinical veterinarian. But of course, dealing with parasite issues was a regular issue when I was in practice as well.
Great. For everyone who's listening, I want to give a quick review of the Ask the Horse Live format. We're going to be starting with the questions everyone submitted during registration. If you have a question you'd like to ask live, or you would like clarification on one of Dr. Kaplan's responses, you can enter it in the chat window in front of you if you are joining us via your internet browser. We're going to do our best to get to as many of your questions as possible. So let's go ahead and get started. Okay, so to frame the conversation, first, Dr. Kaplan, can you explain to us what a fecal egg count test is and why that's important in our parasite control programs for our horses?
Okay, we can't see the parasites in the horses, and we can't measure the number of worms that the horse has. But what we can measure are the numbers of eggs that are passed in the feces of the horse, which reflect the level of worm burdens that the horses have inside. And so the correlation of egg counts and worm burdens isn't super close, but there's a general correlation there. So horses that have very low egg counts are going to have relatively lower worm burdens, and horses with very high egg counts are going to have much higher worm burdens. And by doing egg counts, then we can identify those horses that are the less infected and the more infected. And we can also, the other thing that egg counts are really important for is determining if treatments are effective. One thing I should say about egg counts, though, is the egg counts only reflect the numbers of small strongyle parasites. The egg count doesn't reflect any of the other parasites that potentially can cause problems in horses. So when we talk about egg counts, we're really focused specifically on the small strongyle aspect.
Okay. So we have a question from Anne in Colorado, and she says that fecal egg counts in her area are expensive. She wants to know if it's worth doing them if a horse's weight is good and they have no symptoms of a worm burden or are exposed to other horses. So as you answer that question, can you point out to us what the clinical signs are that a horse might have a worm burden?
Well, the interesting part is that most horses aren't going to have any symptoms at all from their strongyle infections. So actually a starting point for the conversation is that really for the most part, worms are overrated as disease-causing organisms. The strongyles really are not very severe pathogens, and they rarely cause disease unless they reach very high levels. So the question really, in a sense, can be flipped around. So if egg counts are expensive, is it really worth doing them if the horses look good and have no symptoms? So the way I would flip that is, if the horses look good, they have no symptoms, why would you want to treat them with a dewormer? And so that's where the egg counts really become important, because we want to deworm the horses if they indeed have a significant worm burden. And the only way we can know that is by doing the egg count. We really can't tell by looking at the horse. By the time the horse gets an infection that's so severe that it's actually causing symptoms, it's way, way too late. And so we don't want to wait that long. Likewise, just treating without determining if they're, without doing the egg counts isn't a good idea either, because a lot of the drugs that are used, most of the dewormers don't work very well against the small strongyles. Drug resistance is extremely common. And so if you're not checking egg counts, then you're not determining if your treatments are working. And so you're actually really keeping yourself in the dark and putting your horse at risk for disease later on.
So, Dr. Kaplan, we have a question from our live audience. Raven wants to know if fecal egg counts don't show more than one type of worm, are they worth doing?
Yes, they're worth doing, because the small strongyle is the most prevalent, the most common and of the worms. And so fecal egg counts shouldn't be the only factor used for making a decision about deworming a horse. And I think we'll probably get into this a little bit later. But when we're talking about deworming horses, the horses should be dewormed without regard to their egg counts once or twice a year. Because their egg counts is only reflecting the small strongyles. So we want to treat horses once or twice a year to cover all the other parasites. But really, once you get beyond 1 or 2 treatments, then there's really no need to treat for those other parasites. And then after that, we're only going to treat those horses that have high strongyle burdens, as indicated by their egg counts.
So are there other kind of tests that can be done to indicate other parasites are present, like tapeworms, for example?
There is a blood test that can be done for tapeworms. However, it only tells you if the horse has been exposed to tapeworms. It doesn't tell you if the horse actually is infected at the present time. So it's not a very useful test on a horse-by-horse basis. It can be useful maybe for a farm to find out if they have tapeworms on the farm, but it's not going to help you make a decision about whether you need to treat a given horse. So really, there's really no other diagnostic test we have available other than checking a fecal to determine which parasites are present in a horse.
Okay. We have a question from Dawn in North Carolina, and she wants to know if pulling fecals and deworming per the results are, if you're doing that, if there are any undetectable parasites that need to be considered treated in other ways. And I think we've just touched on that already. Do you have anything that you want to add to that?
Yeah, you can just follow up a little bit on what I said previously, that there's undetectable parasites. For instance, the large strongyle parasites are much more important from a disease standpoint than small strongyles are, but they're very, very, very uncommon in managed horses, and we rarely see them. Most farms don't even have them present. In feral horses, we see them regularly. But any managed horse property where horses are dewormed on a periodic basis and have been over a number of years, we simply just don't see the large strongyles anymore. But we can't tell if they're there by looking at the egg counts, and so we want to treat a horse once or twice a year to help prevent the large strongyles from making a comeback, which if we stop deworming horses, that could happen. So that's one thing. Also, tapeworm eggs are not commonly found in horse feces. It's kind of a hit or miss thing. Only if a horse is really heavily infected with tapeworms are you likely to see tapeworm eggs. And so horses, in my view, should all be treated once a year for tapeworms, whether or not you see any tapeworms. So essentially, what my recommendation is that all horses should have a kind of a baseline protocol, and it depends upon where you live. whether and other factors in terms of how many horses, how much grass is available, and so forth. Whether once is enough or you should go with twice. But really, most horses, if even just twice, 2 treatments a year with something highly effective and broad spectrum like ivermectin or moxidectin will serve as a really good baseline program. And the ivermectin and moxidectin will also kill bots. And if you use the product that is combined with praziquantel, so that would be the gold products, then those also would get tapeworms, because praziquantel is a drug specifically for tapeworms that some of the ivermectin and moxidectin products, or the sidectin gold or plus, and the Max gold. I forget. I work with the cattle and sheep and goats, and then all the names are so similar. I get it mixed up whether it's plus or gold, but yeah.
Yeah. Well, and so you mentioning the twice a year is a nice segue into this next question we have from Sharon that came in right before we went live. Sharon says that her vet recommends deworming with a moxidectin and praziquantel product on Christmas, and then following up with ivermectin on July 4th, so kind of using those holidays as markers, and then doing fecals before and then 3 months after the treatments. Is this a correct approach? She's been doing rotational deworming for 30 years, so it's a radical switch for her. So what do you think of that approach?
Where was the questioner from?
She's from Texas, Northeast Texas.
Okay, so personally, I would say that half of that is good and half of it's not. Because the timing is totally the best timing is totally dependent upon where you're located, because the climates are so different in different parts of the country. Mm-hmm. The strongyles do not survive and develop well on pasture during the summer in the southern part of the country where it's hot in the summer. So I would say my view would be in July that ivermectin treatment would not be what I would recommend. But January, giving the moxidectin or praziquantel would be exactly what I would recommend, because that's going to be kind of where it's cooler now. So bot transmission should be pretty much over for the year. Tapeworms, because tapeworms are transmitted by little soil mites. And so when it gets cold, even in the south, when it gets cold in the wintertime, even though it's warm compared to the north, it's usually too cold for those mites to be very active. And so tapeworm transmission will stop as we go into the winter. So treating, and so anywhere in the southern half of the United States, basically treating kind of between Thanksgiving and New Year's would be a really good time to treat with something like ivermectin and praziquantel or moxidectin and praziquantel, so you can get the broad spectrum action where you'll get any large strongyles that are in the horse, you'll get the tapeworms, you'll get the bots, and you'll also get the small strongyles. So you're kind of covering everything with that treatment at a time of the year that's really optimal for getting rid of bots, getting rid of tapeworms, and thereby that'll help have less bots and less tapeworms the following spring by doing it then.
Now, and Dr. Kaplan, I think Sharon makes a really valid point that she's been doing rotational deworming for 30 years and it feels radical to her. Do you have anything to help ease her concerns as she changes from her traditional rotational deworming program to one that's more targeted?
Well, I think the starting point would be is that I think the concept of a deworming program is a very, very archaic one that's no longer really applicable in today's world. First of all, for several reasons. One is that the rotational deworming program was actually developed at the University of Kentucky for the purpose of specifically addressing the bloodworms, large strongyles, Strongyls vulgaris, which is a very, very dangerous worm for horses. It can cause severe disease and colic, and that was the most important parasite of horses back before the 1960s. About 90% of horses were infected with that parasite at the time, so it caused a lot of problems. And that program was designed specifically to address the large strongyles, particularly the bloodworm. However, years and several decades of using this rotational approach had basically put the large strongyles in a really bad state, and so they became very, very, very uncommon. But what it did is it caused the small strongyles to become drug resistant. So back in the 60s, when that program was first recommended and the bloodworms were so important, the small strongyles weren't even considered to have any real importance at all, because they were completely overshadowed by the bloodworms. And so what happened over the next couple of decades is that rotational deworming, it did help eliminate the large strongyles, the bloodworms, but it caused drug resistance to start developing in the small strongyles. And so where we are today is that most of the dewormers don't work anymore against the small strongyles in most of the country. And so if you're deworming a rotational schedule, most of your treatments are not even effective. And so you're not getting any benefit. You're spending money, you're making the drug resistance problem worse, and you're not getting benefit. And the reality is that most of those horses don't even need those treatments. And that's why you don't even notice they're not working, because they're not really needed, because the small strongyles simply don't cause very much disease. And so switching over from a rotational program to a more targeted program, it's not simply you're using less drug, but you're using treatments in a more appropriate manner that are going to actually get the job done much better, but with much fewer treatments.
So we have a question from Sarasha in our live audience, and my apologies if I've mispronounced your name. I believe that she's joining us from Thailand, because I remember seeing her name in the registration report for this event. She has 500 horses on her property, and she wants to know how many horses are required for an efficacy test per farm when you have that many horses.
So if the horses are managed similarly on the same pastures, then you would only need to test about 15 horses. And that would give you a good representative sample of what's happening across the whole group. If they're broken up into lots of separate pastures and separate each other, then each pasture essentially is its separate unit, and then it doesn't really matter how many total horses are there. You still have to view each separate group as a separate group. So that would be the only caveat. But if there's essentially, if they're constantly rotated amongst the different pastures, sharing the pastures, then really all you need is for 15 or 20 horses that have egg counts. Of course, you can't determine a drug efficacy. You can't do a fecal egg count reduction test if it doesn't have any eggs in the first place. So 15 to 20 horses that actually have eggs in their feces would be all you need to get a really good measurement of the drug efficacy.
Okay. We have a question from Rebecca in our live audience, and she has a horse that's in quarantine that came from a farm where their program is to deworm the horses daily for 3 weeks. She said that she's waiting 14 days to do a fecal egg count reduction test on the horse to resistant parasites. In the meantime, what can she do to contain parasite eggs that this horse might shed as it stays in the quarantine pen?
Well, if it's in a quarantine pen, hopefully it's just like a dirt pen. And if it's a dirt pen, then there's no risk of parasite transmission. Just picking up the feces about twice a week will prevent any parasite larvae from getting out into the environment. And so just the hygiene, picking up the feces would probably be the best thing to do when you have one horse in a quarantine situation.
So if you take that manure and put it in your compost pile, do you risk infecting your pastures, or is there a way to compost that well so that everything ends up dead before you spread any compost?
Yeah, the strongyle eggs are very, very susceptible to heat. So if compost is made properly, so it's reaching a reasonably high temperature, that is going to very rapidly kill any eggs, and so it'd be perfectly safe to spread it on the pastures. Of course, fresh manure or manure that wasn't properly composted, those eggs will be alive and could be at risk. But if it's properly composted, reasonably properly, so you're getting some good high temperatures in there, those eggs will be killed quite rapidly, and they'll be perfectly safe to spread on the pasture.
We have a question from Linda in Alberta, Canada, and Linda wants to know, if you're doing fecal egg tests, how long does a sample stored in a Ziploc bag in the refrigerator keep before testing?
We've done some studies on this, and essentially 1 week is fine. It's really best the best thing to do when you collect a fecal sample from a horse in a Ziploc bag is to squeeze out all of the air. Really get all the air out of it. So really squeeze it tight and like roll it up like a cigar almost, and get all of that air out. And without the air, the eggs can't develop, and that'll help preserve the feces in its original state. And so if you do that and you put it in the refrigerator, you have at least a week with no problems whatsoever. It's possible you can even go longer than a week, but I don't recommend that.
Our next question is from Nikki in Alberta, Canada, and Nikki wants to know if a deworming program can work without the fecal egg exam.
I would say no, because again, I say a deworming program, we need to get away from the idea of a deworming program, because deworming programs fail big time because of the drugs don't work so often on so many farms. So we really need to think about parasite control in a more holistic fashion, where we're not only where drugs are important, the dewormers are important, and they're an important component of our parasite control, but they're not the only component. When we talk about a deworming program, we're kind of like removing everything else out of the equation and saying all we have to do is deworm horses with drugs, and then our problems are solved. And the reality is that's not true. Because the drugs often aren't going to work anyway. So it's important to look at the pasture, and the horses have to have enough grass, so they're not grazing too low. About 75% of all the parasites are down in the bottom 2 inches of grass. So if horses are grazing down a pasture down so it looks like a golf course, that's really bad. They're going to pick up a lot of parasites. But if the grass is consistently at 4 inches or a little bit higher, 4 to 6 inches, they're actually going to be ingesting very few parasites. Also, their nutrition will be better if they're malnourished. If a horse gets really hungry, it's going to graze all the way up to the feces. Horses normally have a very strong avoidance behavior. They don't like to graze near feces, and so you'll see tall grass growing around the feces in those areas of the pasture where the horses tend to deposit their feces. That should be nice and tall grass. If you can see the feces pretty readily, meaning this grass has been eaten down all around it, that means those horses are really hungry, and hunger will override their avoidance behavior. And the closer they graze to the feces, the more parasites they're going to pick up. So controlling parasites has a lot more to do with overall good pasture management. With targeted use of dewormers is how you're going to get your best parasite control. Just using dewormers without thinking about all those other issues is actually quite risky and could lead to diseased horses if the parasites get out of control. And I should say that every case that we've seen at the University of Georgia where we have a severe clinical case due to small strongyles, in every case it was from a farm that dewormed very frequently. But it turned out that they had drug resistance on their farm, and they hadn't been checking fecal, so they didn't know that. And so they thought that everything was fine and rosy, but in fact, there was a storm brewing that they were not aware of.
We have a question from Cindy in Wisconsin, and she said that you hear a lot of talk about horses that are heavy shedders. What makes a light shedder? And can you define those heavy shedders, medium shedders, and light shedders for us?
Yeah, so the way we measure the eggs in feces is on a number of eggs per gram of feces. So we measure out, we weigh out the feces, and there's a few different methods that we use. McMaster is the most common one, but there's a few others we can use. But basically we can actually calculate the numbers of eggs in 1 gram of feces. So most horses actually have very, very few eggs in their feces, meaning that their immune system is controlling the small strongyles. And so they don't need dewormers to control the small strongyles because their immune system is doing it for us. And so horses, we consider horses that are low shedders would be less than 200 eggs per gram. And then horses that are high shedders, we consider more than 500 eggs per gram. This is for adult horses now. I'm just talking about adult horses because the whole concepts differ between how we're going to approach parasite control in foals versus adult horses and yearlings. But this is for adult horses, these numbers. So more than 500 eggs per gram is considered a high egg count. Less than 200 is a low egg count. And then in between would be 2 to 500 would be a moderate egg count. It gets a little complicated splitting up horses into low, moderate, and high egg shedders. So I think it makes it much simpler and easier to implement if you just kind of split low versus high shedders. And then the number that you should use for a cutoff is pretty arbitrary. 200 is the most common. Some people use 100, some people use 300. There's really no evidence that any one cutoff is going to make a difference versus the other. But essentially what you can do then is you can say, okay, these horses are low shedders. They always have less than 100 or less than 200 eggs per gram. And so they're going to need less deworming. And then these high shedders that have 500, 800, 1,000, 1,500 eggs per gram, those are horses that we have to treat much more often because their immune systems are not doing the job to control the parasites, whereas the low egg shedders, the immune systems are doing it.
Okay. And so are there some reasons that horses might be one or the other, like specifically, I'm thinking Cushing's comes up a lot, PPID with horses being prone to parasites?
Mostly it's just an innate characteristic of the horse, and it's very consistent over time. There's a little bit of evidence that horses with Cushing's tend to have higher parasites, but there's also been studies that have shown that there's no difference, that it didn't cause an increase in parasites. So, but it's basically a very strong characteristic of a horse. And so what we find is that if you even do 1 egg count on a horse and you've waited long enough past the last treatment that the last treatment is not biasing the level of egg shedding, that 1 egg count on a horse will characterize that horse correctly about 75% of the time as a low or high egg shedder. And if you do a second egg count on that horse and you get the same result as the first, then there's a 90% probability that horse is always going to be in that category. There was an interesting study done in Denmark where dewormers are available by prescription only, and there's no prophylactic deworming allowed. So they did a study where horses were only dewormed if they had egg counts of 200 or more, and egg counts were done twice a year. And so all horses that had egg counts higher than 200 were treated. If they had less than 200, they weren't treated. And this was a 3-year study. So what they found was that if a horse had no eggs in their feces on 2 consecutive samplings, the chances that they'd have 0 in the next sampling was over 80%. If they had less than 200 on 2 consecutive samplings, so that would be a year apart. 2 samplings is 1 full year apart. They had about a 90% chance of being less than 200 on the next one a year later. However, if they had more than 200 eggs per gram on 2 consecutive egg counts, then the next egg count they had still had like a 70% chance that they were going to have more than 200 eggs. But what's interesting is that the horses that had more than 200 eggs per gram on those first 2 samplings got treated each time. So they were treated, and then on the first sampling, and then the next sampling, they were treated again, and then the next sampling, they still had a high egg count. Whereas the low egg shedding horses, they didn't get treated at all, and they still had a low egg count. So what it shows us is that the egg shedding of a horse is very, very consistent, and low egg shedders are going to be low egg shedders even if we don't treat them. And the high egg shedders are going to continue to be high unless we treat them often enough as to keep their egg counts lower.
We have a question from Hernan in our live audience, and he would like to know when and how is the best way to treat or prevent encysted small strongylls?
Well, there's no way to prevent encysted small strongylls because that's just a natural part of their life cycle. So any horse that's infected with small strongylls, then those worms are going to become encysted in the gut. Most of them are going to be in the cecum. Some will be in the ventral or dorsal large colon. But the encystment is a natural part of their life cycle. So there's no way to avoid having encysted larvae. The problem was when you get huge numbers of encysted larvae. So it's dramatic and remarkable, but horses can have tens of thousands of small strongylls and still be perfectly healthy. Horses can even have a few 100,000 and be perfectly healthy. When we see horses that have severe, clinical diseases where they have diarrhea and weight loss, these horses often have over 1 million worms. So in that situation, you have basically a complete failure of parasite control in those horses. So you don't have to worry about keeping your horses worm-free. That's actually impossible to do. And low to moderate numbers of worms with the small strongylls simply are not really harmful to that horse. And the horse's own immune system just kind of keeps them all in check. And so if you actually do get a problem with encysted worms, then really the only drug that's effective is Cydectin. The Panacur it has a label approval for encysted larvae, but recent studies have shown that it's actually not very effective anymore because of drug resistance. So the only drug right now that seems to work well against those encysted larvae is the Cydectin. And that's the drug that if you have a horse that's showing symptoms of parasitic disease, that's the drug that should be used.
Cheryl, live audience, says that she's had fecals done for the past 3 years and they've come back negative, so she has not dewormed her horses. She wants to know if she should deworm anyway and with what and when, and she's located in Maine.
Yeah, that's a great question, and that gets back to one of the important issues, is that the egg counts only reflect the small strongylls. So we definitely want to deworm horses even if they have no eggs in their feces. Now, we're not deworming for the small strongylls. Again, the horse's immune system is taking care of those just fine, but we want to take care of the other worms that the horse can get. So we want to make sure we're treating once a year to get tapeworms, once a year to clean out bots. We want to make sure that if there are any bloodworms or other large strongylls around, even though they're very rare, they're not extinct. So we want to make sure we're getting at least one treatment in a year to kill any of those, so to not let them magnify themselves into levels that would be a problem. And so to achieve all the goals of getting all those parasites, my view is for a baseline treatment, a once-a-year treatment. So a horse like that up in Maine with 0 eggs per gram, I would just give a once-a-year treatment with either ivermectin or moxidectin in combination with the praziquantel. And I would give that sometime in the late fall after it gets cold. So again, because the bots will be done for the year, tapeworms will be done for the year, and then clean that out. The large strongylls will be done for the year. So basically, you treat with that drug combination, and you're pretty much going to get all the parasites that you really have to worry about, and that's probably all that horse is going to need. But I definitely would make sure that one treatment is given. We don't want to stop deworming completely just because horses have low egg counts all the time.
Okay. We have a question from Sharon in our live audience, and she wants to know if all combo dewormers or those with multiple drugs in them are created equal.
Well, there's only really two products, two drug combinations available for horses. There's ivermectin and praziquantel, and which is sold in a few different names, and then you have the moxidectin with praziquantel, which is the Cydectin Gold. Those are the only drugs that actually come in combination. and they're going to both I mean, obviously there's differences between ivermectin and moxidectin. They basically are very similar in most respects, but the moxidectin in the sidectin product kills encysted small strong giles. The ivermectin does not kill encysted small strong giles. So that's one difference. The praziquantel is in both products. It's going to kill the tapeworms pretty much equally. So there's not, overall against most parasites, there's not going to be a big difference. The only difference would be on the encysted small strong gile side.
Pablo is listening in our live audience, and he wants to know if drug-resistant parasites can pass that resistance on to future generations.
Yeah, absolutely. The worms are males and females, so and they have sex and they produce offspring. The eggs are basically the offspring, and so if resistant worms mate, then their offspring are resistant as well. So that's how. So that resistance just gets passed on from parents to subsequent generations of worms, just like any other type of genetic trait. So yes, once you have resistance in worms on your farm, then that resistance is just going to continue and just get worse the more and more you treat.
So if there's a genetic link in resistance for the parasites, is there a genetic link possible in our horses that are high shedders versus low shedders? Or do we know?
Almost certainly there is. It hasn't been well characterized in horses. We certainly know in sheep, where this has been looked at very closely, that susceptibility to the parasites is very much a hereditary trait. That can be passed down from generation to generation. And so with sheep, you can actually make breeding and culling decisions based upon how wormy a given ewe is, or how wormy a ram's offspring are, and you can actually have subsequent generations that are less and less parasite susceptible. In horses, that hasn't really been characterized very well, and it's probably not something that people are going to breed horses based on anyway. But it most likely is a hereditary trait as well in horses.
We have a question from Brenda in Georgia about deworming foals and when that should be done and with which products. But you've mentioned several times that we shouldn't be focused on the deworming part of the program, but the parasite management part of the program. So how do we handle these young horses, the babies, and managing parasites in them?
It's actually managing parasites in foals is actually very, very different than adult horses. As I mentioned, most adult horses can get by very, very well with minimal deworming. Foals are the most susceptible age. They can get very high levels of parasites, and they also get roundworms, Parascaris, and those roundworms can be quite pathogenic, cause a lot of disease. So we really want to keep an eye on that very closely. So if we're going to see disease in horses from parasites, we're going to see it in foals. So we want to monitor foals closely. And so doing fecal egg counts in foals is actually much more important than doing it in adult horses. And really making sure that we're controlling the roundworms. Now, one of the issues is the drugs that we have resistance to in the small strong giles tends to be like all the benzimazole drugs. That would be anthalcide and Panacur Safeguard. There's a lot of resistance to the small strong giles there. Also, Strongid, a lot of resistance in the small strong giles. But there's not much resistance in the small strong giles to the ivermectin and the sidectin. However, in the roundworms in foals, it's actually completely flipped, where resistance to ivermectin and sidectin is very common in the roundworms of foals. But the roundworms tend to be still pretty susceptible to Safeguard and anthalcide and Strongid. Of course, it varies from farm to farm. That's why every farm testing needs to be done on every farm. But just as a generality, we see a lot of drug resistance to the ivermectin and moxidectin in the roundworms, but not to the other drugs, and completely flipped in the adult horses for the, where the small strongyles are most important. So we recommend, based upon the life cycle of the roundworms, it takes about 10 weeks for those worms to mature to the point where they're laying eggs. Foals will get infected very rapidly after being born. So we recommend treating right at 2 months of age. So that's before that the worms will mature and produce eggs. We want to do it then because we want to kill those worms before they can produce lots of eggs that are going to contaminate the environment. Because once those eggs get in the environment, then foals are going to continue to get reinfected, and those eggs can live for a long time. So we want to prevent that egg shedding. So we recommend treating at 2 months, all foals. And this is where I wouldn't recommend using ivermectin or moxidectin. I'd recommend using something like Safeguard or Anthracite and Strongid. And actually, my recommendation is to use those together. Strongid along with either Anthracite or Safeguard would be a really good choice. Using those drugs together in combination helps really make sure you get very good efficacy, and also decreases the chance that you're going to get resistance to either drug. So 2 months would be the first treatment. Then there was some modeling that was done, some computer modeling that was done recently by a parasitologist in New Zealand, and he looked at all the different treatments and how much impact it had on development of resistance. And based upon that modeling results, it looked like treating at 5 months was the best to get good parasite control and have the least amount of drug resistance develop over years. So basically what we're recommending now is that all foals be treated for the roundworms at 2 months and 5 months of age. And then after that, probably checking egg counts at about 7 months of age. Once they get to be about 8 months of age, they're developing pretty good immunity to the roundworms, and they'll start controlling them themselves. So you'll see, just without any treatments, that once foals get to be about 8 months of age, their egg counts for roundworms are just going to go way down, even if they're not treated. And by the time they're a year old, usually you won't even see any roundworm eggs, or very, very few. So basically what you need to do is you need to control those roundworms in the early months, between about 2 and 6 months is really the critical time in those horses. Also, I should say is that because roundworms, the Parascaris roundworms, are so dangerous, if foals get very heavy burdens of them, they can cause pretty severe disease. That this is where it's especially important to monitor egg counts and to do the fecal egg count reduction test and make sure that the treatments that you're using are in fact working. I do know of cases where horses where foals were treated with ivermectin monthly even, and they had some very expensive foals die from roundworms because the worms were resistant to the ivermectin.
We have a question from Jacqueline in Wisconsin, and she wants to know if there are any natural ways to treat horses for parasites rather than relying on chemical dewormers.
Well, it depends. It depends. There's natural ways to control parasites, and that's going to be picking up feces. There's lots of ways to do it depending upon the environment the horses are in. There's various types of vacuuming systems that can be pulled with a tractor. There's little scooper things that you can pull behind a rider mower, and picking up feces is actually more effective than deworming in controlling parasites. So you can do that without any drugs. Also, as I mentioned, monitoring the height of the forage, the grass on the pasture, making sure that they're not grazing below 3 or 4 inches. You never want to have animals graze less than 3 inches. 4 inches would be a better target. When they're grazing down to 1 or 2 inches, that's going to be bad in terms of their parasites. So there's a lot of holistic things you can do that don't involve any drugs. On the treatment side, unfortunately, there are no natural dewormers that are effective. Every natural dewormer that's been tested, whether it be in sheep or goats or cows or horses, has never shown to be effective against worms. And so that goes for diatomaceous earth. It goes for any of these other herbal dewormers. They simply just don't work. We've done some studies in my lab. Some of my colleagues have done studies, and there's yet to be a study that has shown that they really work.
We have a question from Isabel, and she wants to know why we can't use injectable ivermectin in horses.
Actually, when ivermectin was first marketed and sold for horses back in the 80s, in the mid 80s, it actually was an injectable. But the problem was that a small percent of horses had some severe reactions to the injection. And so it was pulled from the market and replaced with the oral gel paste, actually. So that's why. So most horses were fine, didn't have a problem with it, but some horses had some bad reactions to it. And of course, you can't tell ahead of time which horses are going to have the reaction. So it was pulled from the market, and it's just a safety issue.
Okay. Hernan in our live audience wants to know if there are any new deworming drugs that will be coming onto the market.
Great question, because the answer is no. And that's why drug resistance is so concerning, and why doing everything we can to protect the efficacy of the drugs we have is so important. Because there won't be any new drugs anytime soon. We have the drugs that we have, and drug resistance is getting really severe. You know, essentially, the thing that's making it the lucky thing we have is that the large strongyles have become so rare that they're not a problem, and the small strongyles that are hugely common, prevalent, horses are infected with. Literally almost every horse is going to have tens, if not hundreds of thousands of these worms, but they just have very, very low disease potential. That's what's been saving horses from having a problem, because drug resistance is becoming, to our dewormants, is really becoming a severe problem, and we're running out of drugs that are effective. And there are no new drugs in development, and so it's hard to say how long it will be for a new drug for horses, but I could say probably very optimistically that it won't be sooner than 7 years, and it could probably be more than 10 years from now before we will see any new drugs. It could be a lot more than 10 years potentially, because there's nothing for development in horses right now, and really nothing new in development for sheep, goats, or cattle either. And it's always going to be developed for cattle first, because cattle is by far the largest market. The horse market really isn't big enough to develop a new drug just for horses. So the drug is going to be developed for cattle first, and then also developed for horses probably around the same time, a little bit after. There's nothing new for cattle that's coming down the pike, so we know that we're probably at least 10 years away, and possibly much longer than that, before we're going to see a new equine dewormer, which really is why I emphasize so strongly we have to do everything we can to protect the drugs we have now. And if we just overuse them, continue to overuse them unnecessarily, we're going to get to the point where we have nothing left that works, and then we're going to have big problems.
Joan is in British Columbia, Canada, and she says that her horse only gets to graze when he's hand grazed, and he's never in a field or with other horses. Does he still need to be tested and dewormed?
I'm not sure I understand the question exactly, just hand grazed. If there's all worm transmission is going to occur on the pasture itself. So if the horses are depositing feces on the pasture and are grazing on the pasture, they're going to get infected. If they're not doing that, then they won't get any parasites. So horses that are kept in dry lot are not going to have any of the intestinal worms. They still can get some worms that are transmitted by flies, but they're not going to get any off the ground because those worms require a grass environment. So all the strongyles, tapeworms have to have grass, because it's that soil mite that lives in the grass that has to become infected. And so I'm not sure I understand the question exactly, but it has to do with exposure to pasture. If horses have exposure to pasture where feces are being deposited, then there's a risk of picking up. It's almost for sure they're going to pick up parasites. If they're not grazing on grass, then they're not going to pick them up.
We have a question from Rose in our live audience, and she wants to know if a daily dewormer is ever a good idea.
Yeah, it is. It can be a good idea. My view is it should be used in a very targeted, um, um, fashion, where you don't put all horses on it. Use it selectively for horses. So, for instance, if you have a high egg shedder that seems like no matter what you do, is always shedding lots of eggs, that would be a horse to possibly to put on a daily dewormer. A horse that has a low to moderate egg shedding, it wouldn't make really much sense to me to put that horse on a daily dewormer. Another time where the daily dewormer could be effective, if you have your horse stabled at a farm that where there's no fecal testing occurring, and people might be not deworming, or maybe you're deworming with things that don't work because of resistance. Then you could put your horse on a daily dewormer. If it's sharing pastures with these other horses and you suspect there's a lot of parasites out there, you could put your horse on a daily dewormer and thereby protect that horse. But at the same time, with that said, you need to test and make sure that is working. So the only daily dewormer is the Strongyl, the Pyrantel. It's sold, Strongyl is the most common brand name. It's sold to some other generics. But you'd want to test using a full paste version first. Make sure that you're getting very high egg reduction, because if the paste doesn't work, then the daily dewormer is not going to work. And there's a lot of resistance to that drug out there. So you need to make sure it's working before you're using it and relying on it.
Karen in Kentucky wants to know if tail rubbing in a horse indicates that it has worms, and if so, which kind would be responsible for that?
Yeah, there's one specific worm that will cause that, pinworms. So pinworms live in the rectum, and the females will actually crawl out of the rectum and deposit their eggs right around on the outside, on the skin just outside the rectum. And it's very irritating to the horse, which is going to cause the horse to rub. So if the horse is rubbing its behind, rubbing its tail, and you see hair loss there, there's a strong possibility that the horse has pinworms. That's the only worm that's going to cause that. We also were seeing a lot of drug resistance in pinworms to ivermectin and moxidectin. So if you have pinworms, that would be where I would also recommend using something like the Strongyl or Safeguard or Anthelcide, something like that. And again, I recommend giving those in combination. Whenever you're using them together gives you the best results, and I recommend doing that all the time. But those would be the best choice for pinworms.
Valerie and Marilyn would like to know your opinion on the efficacy of using diatomaceous earth as a dewormer.
Yeah, so as I mentioned before, those natural dewormers just don't work. Diatomaceous earth has been tested in a number of different studies, different animals, with sheep, goats, cattle, horses, and there's never been any demonstration that it has any positive benefit on controlling worms. So I would say the answer would be no to that.
Debbie is in Texas, and she wants to know if dragging the pasture instead of picking up manure piles is an okay thing to do.
That's a good question. It all depends upon the timing, because if the worms can be spread. Sorry, let me back up. If you want to do it, if you're going to drag the pastures, you want to do it when it's hot and dry, so the larvae that are spread onto the pasture are going to be killed rapidly. If you do it when it's more moderate, or if it's wet, essentially all you're doing is taking the worms that are concentrated in the feces and spreading them all over the pasture for the horses to get exposed to them. So picking up feces in general is going to be a much better approach. Dragging pastures can be a great thing to do, but it needs to be done during hot, dry times of the year, and it's best to keep the horses off the pasture for several weeks after you do it. You definitely don't want to do it during cooler weather times of the year, because you're just going to create a big worm problem if you do that.
Okay. We have a similar question. It's from Brian in Nevada, and Brian wants to know how effective ultraviolet light is in killing the parasites and the eggs in the manure. Is it the ultraviolet light or is it the heat that causes that?
It's mostly going to be the heat. Ultraviolet light itself actually would kill the worms pretty effectively. The problem is that the worms don't expose themselves to the UV light. The worms are either going to be protected in the feces, or they're going to be protected at the lower levels of the grass. Remember, so like 75% of the worms are in the bottom 2 inches of grass, and so they stay there because it's moist, it's protected, and so it's a better environment for them to survive. And so the reality is, although UV light actually would be very good, there's not enough UV light actually getting to the worms to have a big impact. So it's really going to be mostly the heat and desiccation that's going to get it done.
We have a question from Rebecca in our live audience, and she wants to know, if you enter a dirty paddock on another property, can you track parasites back home? And if so, can you prevent this by disinfecting your boots, or do you have any other suggestions?
Yeah, well, fresh feces, it takes the parasites about a week to develop from the egg into the infective stage. And so fresh manure is not going to cause any risk, but manure that's been around for a week or more, then there can be lots of parasites in those feces. And if you get feces on your boots, then you can actually carry the larvae with you. Again, if it has to stay moist, though, the worms don't do well once they get dried and desiccated. So, but if it's moist, then you could carry worms on to another property that way.
We have a question from Adam in North Carolina, and he has cattle on his property that the horses share pastures with. Are there any parasites that can infect both horses and cattle? And if so, is there any way to prevent that?
There is basically one parasite that horses and cattle share, and it's not a very important parasite. So it's really of no real concern. In fact, it's a great benefit to share pastures with horses and cattle, or to rotate between horses and cattle, because they don't share parasites. Cattle parasites only infect cattle. Horse parasites only infect horses. Again, with this one exception for a parasite it's a stomach parasite that's not very common and not very important. And so, but all of the important parasites that are very common are not shared between horses and cattle. And so, actually, mixing different species on the same pasture, or rotating cows into the horse pasture and horse into the cow pasture is a wonderful thing to do to control parasites, because the opposite species will essentially serve as a vacuum cleaner, eating up the worms that were left behind. So the horses will deposit the worms onto the pasture. Then if they get moved to the cattle pasture and the cattle get moved to the horse pasture, the cattle are going to eat all those horse worms, and the horses are going to go to the cattle pasture, eat the cattle worms. So then when you flip them back, then the pastures are already cleaned up by the other species. So it's a really great holistic way to control parasites, and I highly recommend it if on farms that can pull it off.
Yeah. Is that true with other livestock like sheep or goats?
Yes. Yeah, basically there's almost no, there's that one parasite species, which it's called Trichostrongylis, but it's just not a very important parasite, is the only one that's shared amongst sheep, cattle, goats, and horses. And every other important parasite of horses or of the ruminant animals is not shared. So that strategy works for any when you have horses involved. It doesn't necessarily work as well if you're rotating the ruminants amongst each other. They share more things, but with horses, just don't share parasites with the ruminants.
Okay. I think we have time for just one more question. Pablo in our live audience wants to know if there's any reported drug resistance in botflies.
No, there is no reported resistance in botflies. We only have one drug that works for bots. That's two drugs, one group of drugs, ivermectin and moxidectin. Those are the only drugs we have available currently that kill bots. We used to have some other things that would kill bots. They were essentially in the insecticide group of drugs. But anymore, the only things we have available for bots is ivermectin and oxytectin, and there's no evidence that there's any resistance developing.
Okay. Okay, well, unfortunately, that's all the time we have for tonight, and it sounds like your dog's ready for you to go feed him dinner.
Yeah, I think so. I think they're tired of. They want me to come back out.
Unfortunately, that is all the time we have. I want to thank you, Dr. Kaplan, for joining us tonight and answering all these questions.
You're very welcome. Thank you for giving me the opportunity.
Also, I want to thank everyone who submitted questions ahead of time and while listening live. We had some great questions tonight. I'd like to invite you to join us next month for Ask the Horse Live. We're going to be talking about an important topic, wildfire and barn fire prevention here on the West Coast. We've been dealing with a lot of wildfires, and so it's just about that season. Until then, from all of us here at the Horse, we hope you have a great night.